to Foresights TV with me, Isma. With COVID-19 cases surging once again in parts of Southern Asia, most notably Singapore and Hong Kong, India health authorities are ramping up monitoring efforts to prevent a similar resurgence. On May 19, 2025, India's active COVID-19 case count stood at 257, with the Union Health Ministry stating the situation is under control. However, experts remain to alert given the regional trend and the emergence of the JN1 variant, a muted descendant of Omicron BA.2.86. A recent review meeting by top Indian health agencies emphasized preparedness and containment, even as authorities clarified that most current cases in India are mild and not requiring hospitalization. Here's a special report from Foresights TV. India has recorded 164 new COVID-19 cases since May 12th, with Kerala 69, Maharashtra 44, Tamil Nadu 34 reporting the highest numbers. Other states like Karnataka 8, Gujarat 6 and Delhi 3 have also reported a few cases, while Haryana, Rajasthan and Sikkim each reported one case. Despite these rising numbers, the total active cases remains low at 257, especially when considered against India's population of over 1.4 billion. A high-level review meeting was conducted under the chairmanship of the Director General of Health Services. Participants included officials from the National Centre for Disease Control or NCDC, Indian Council of Medical Research or ICMR, Disaster Management Cell, the central government hospitals. The consensus was clear. The situation remains manageable and no spike warrants alarm at present. However, active surveillance and testing protocols have been reinforced, particularly in areas reporting new cases. Most of the recorded cases are reportedly mild, with no hospitalizations, and health officials assured that essential infrastructure and resources such as testing labs, hospital beds, oxygen supplies remain in place and are being monitored for adequacy. The centre has reiterated its focus on public health safety through regular assessment and readiness drills. Despite overall control, recent deaths in Mumbai sparked public concern. Two patients, a 14-year-old girl with nephrotic syndrome, a 50-year-old woman with cancer, died at KEM Hospital after testing positive to COVID-19. Hospital authorities backed by the Brihan Mumbai Municipal Corporation or BMC clarified that these fatalities were due to pre-existing medical conditions, not COVID-19 per se. Nonetheless, the cases drew attention to COVID-19 protocols, especially in urban hospitals. BMC responded by reaffirming its commitment to preparedness. It has also allocated special beds and isolation rooms in municipal hospitals, promising to scale up capacity if needed. From January to April 2025, Mumbai recorded minimal COVID-19 cases, but some uptake had been noted in May. The civic body urged citizens not to panic, highlighting that COVID-19 has transitioned to an endemic status and that the city's health department continues to monitor the virus closely. This sense of cautious preparedness mirrors global sentiment as neighboring Asian countries report rising case numbers driven by the JN1 variant. Hong Kong Centre for Health Protection has warned that the region is entering another high-activity phase, with infection circles repeating every 6 to 9 months. The city recorded 31 severe cases in 1 week, a 12-month high. Singapore similarly has seen COVID cases jump to 14,200 in the first week of May, up from 11,100 the previous week. Authorities there stressed the need for continued vigilance, acknowledging that periodic waves are now expected year-round. Internationally, COVID-19's resurgence has triggered renewed interest in long-term pandemic management. The World Health Organization or WHO, responding to global demand for equitable access to vaccines and treatment, saw 124 member nations vote in the favor of global pandemic treaty. This agreement aims to address structural disparities revealed during the first wave of COVID-19 by improving preparedness and ensuring more just distribution of medical resources during future pandemics. WHO Director General Dr. Tedros Adhanom highlighted the treaty's significance, saying it marks a united global stance towards preventing, detecting and responding to pandemics. The agreement, to be formally adopted at the World Health Assembly's plenary session in Geneva, outlines strategies for rapid response. vaccine equity, and shared technological innovation based on lessons from 2020 to 2022. China and South Korea have also taken concrete steps. South Korea extended its COVID vaccination campaign for high-risk groups, particularly those over 65, encouraging them to take updated JN1 variant shots. China's health ministry reported that positive COVID-19 test rates in hospitals more than doubled in 5 weeks, signaling a need for sustained public health vigilance. India's current COVID-19 situation remains stable, with only mild cases and no large-scale hospitalizations reported. However, as the virus sees renewed activity in neighboring regions, particularly through the JN.1 variant, Indian health authorities are taking no chances. Proactive surveillance, inter-agency coordination, and preemptive hospital readiness for the cornerstone of India's approach to keeping the situation under control. The deaths in Mumbai, though unrelated directly to COVID-19, underscored the need for transparent communication and preparedness in urban health centers. International developments such as the WHO's pandemic treaty further reflects the world's commitment to never repeat the chaos of the first global outbreak. India, while largely affected in the current phase, remains alert and responsive, setting an example of calm vigilance. Continued public cooperation, accurate information sharing, and adaptive health policies will be crucial as the world navigates the long tail of the COVID-19 era. That's all for today. Thanks for watching Foresights TV with me, Isma.